Thank you for audience for joining us today. This is Quick to Politic. I'm your host, Ernestine Lyons, and this is the political talk show where we discuss politics, history, economics, the world, and it's a social commentary series that's all about solving contemporary issues and problems facing the world. And it may not be a panacea. We might not solve everything, but we're at least here to have like a discourse on, how to make things better and how to remake the new normal. This series, just for a little background, it started as an idea where, how can we, just get a little bit more concrete information on what the new normal will look like in a post-COVID world. So without further ado, here is our guest, Stewart. Oh my God, I don't even know your name. We got Scott Stewart here. And tell us a little bit about yourself, Scott. Thank you so much for being on our show.
Sure. So my name is Scott Stewart. I actually am a co-worker of Ernestine Lyons at the lovely Build Institute. I am their development director. I've spent the last 7 years really digging deep into nonprofits, digging deep into social issues, and kind of looking at frameworks and strategy about how to move them forward, and the interconnectivity between a lot of social issues and how to eliminate those barriers in society, very many of the systemic barriers that exist. So whether that's, my previous job was in healthcare, so really focusing on community health, public health, and the different factors that run into that. Doing development, but also looking at how to partner in different ways. And then I also serve as the chairperson for the board of directors for Wayne County Safe, which is a comprehensive agency focusing on survivors of sexual violence and addressing that. And then I also started Pontiac Soup, much like yourself, Miss Ernestine, in the city of Pontiac. So doing lots of different things like that. Yeah, that's me.
Thank you, Scott. Thank you. And I just realized that as a car zooms down my street at top speed, I don't really talk too much about Harper Woods, and I'm a councilwoman there. And prior to that, I started Harper Woods Soup. And of course, we both work for the wonderful organization that, is the parent of, Detroit Soup, and sort of started that movement of these community and neighborhood soups that it's a micro lending or micro granting dinner. And, a lot of folks come with new business ideas or creative projects that are going to positively impact communities. And, so they pitch these ideas. It's a little like Shark Tank when you think about, an entrepreneur or somebody who's creative really standing in front of like their community or their peers and, asking for a vote, and everybody gets together and has a sense of community over a bowl of soup. So you have soup, salad, all kinds of food. And I started that because in Harper Woods, I really wanted to create a feeling of unity where people are not zooming down the street at top speeds. And but yes, I really wanted to talk with Scott on Quick to Politic because all day at work, all we do is work, of course. But, in between there, we have conversations, like political conversations. And I'm like, Scott, how do we fix this? What's the answer to this? And of course, Scott always has an answer. So I'm just like, okay. One of my first questions I really wanted to delve into asking was, how can we solve some societal problems that have been exposed, like gaps in the system that have really, existed for working class people, like socioeconomic gaps and, issues and inequities in healthcare. They've existed for a really long time, but now we see that with this pandemic and the problems that have arisen from, just not necessarily having a great system in place, especially for the most vulnerable in our communities, we now see that there's an exposure of like, okay, this doesn't work. This isn't going to be sustainable. And it's not going to include everybody. So there's also problems with unemployment and sick leave. How can we solve those systemic issues in healthcare? What is the answer?
Yeah, right. I mean, what's the answer? I think plenty of people could give a million different answers, right? But I think, the core and crux of what we need to do during this time is really start to take a look at our systems. Because when you start to look at, so when I started my previous job at Honor Community Health as the name, we really started digging deep into what are those systemic barriers and how are all these systems interconnected. So I think in the healthcare industry, I think what is nice, for record, I never thought I'd work in healthcare. I really was like, I hate healthcare, because all I thought about was hospitals and insurance companies and kind of how predatory a lot of them are in many cases, and how they aren't really effective. And so I found federally qualified health centers, community health centers, and kind of thought and really was able to think differently about healthcare as a whole, and how we can really address the needs. So I think what I found in healthcare, what is really interesting is, the framework of social determinants of health. So I think what I've seen in healthcare compared to others is that this is one of the more comprehensive frameworks that I've seen on how we really see the interconnectivity between social issues. And so, what social determinants of health basically says is about 20% of your health is actually clinical care, right? Access to care issues, the quality of care that you're receiving. But the rest of that 80% are all issues that are structural, are environmental, are all of that. So about 30% are health behaviors, so drug and alcohol use, diet and exercise, tobacco, sexual activity, those things. Another 10%.
Just for 1 second. So you're saying social tenets of health.
Determinants.
Social determinants of health. Okay,
Yeah.
gotcha. And I'm glad, because just for clarification, from a person who's, that lexicon is a little, out there.
I appreciate that, because in the healthcare world, we always like to use acronyms and big old words.
Okay.
So, but that's the framework. It's it's SDOH.
Okay. Thanks for clarifying that.
Yeah, absolutely. So, then you look at things like physical environment, like air and water quality, housing and transit, all of those types of issues, and then social and economic factors. So things like, do you feel safe in your community? What's your median income in the area? All of those kind of areas. You talked about unemployment and sick leave. Right now we're seeing in this crisis that it's disproportionately affecting people of color and people in inner cities. And the reason for that is it's not a mystery as much as people like to pretend. Why are people of color being impacted so negatively? Well, it's because of all these barriers that we've seen for many, many years.
Right.
Continue to ignore, and we haven't done a good job with looking at how these inequities are faced, how these inequities are really prevalent, and moving that needle forward with addressing them. So even education is another big one, right? So we know that education is one of the main factors that moves people forward, but yet we disinvest in education at every chance we get. As we go through this COVID-19 crisis, we know that money to schools is going to be, we're facing a $3 billion budget deficit in the state of Michigan right now, and more than likely, what's going to be hit with that? Schools. Schools are going to get less money again. For the first time, we were talking about increasing their allowance, and now we are basically saying we're going to take some away. And so how does that impact in a time when and also even with school funding as it starts, is we know that it's disproportionately impacting inner city schools and those in urban areas compared to others that get more. And so as we look at all these different issues, as I started to look at issues at Honor Community Health, I said, all of this is connected. We can't just say, okay, we're going to be here and provide clinical care. We know that most of our patients at Honor Community Health, don't have access to transportation, don't have access to quality housing, are dealing with a lot of community safety issues, those types of things. And so how do we address that? Same as addressing the needs of our Hispanic population, it was, we need to be making sure that we are getting people from that community to be to be coworkers at our facility that can translate directly for those individuals, rather than just saying, oh, let's just translate over the phone. They want to feel that connection to someone in their community.
Exactly. There's actually been a lot of movement, and a friend of mine who works for Google Translate was mentioning that there is now a movement for more critical translation services,
right?
Because those are services that sometimes you're not always going to get the most accurate representation of what the language is actually saying to that person, right. And they're going to feel like translation services are kind of letting them down, and that's been an issue in our society, as a part of, I guess that would also be under social determinants of health, because we talked about these issues ranging from socioeconomic status and access to transportation, access to, just quality education. They're going to determine how healthy you are. The
Right.
more you know about nutrition, and the better you're going to eat. And so,
And not just nutrition, but culturally competent nutrition, right? I think something I see a lot of times with nutritionists and dietitians are, well, you need to get away from everything that you're currently eating and just eat.
what else is there? You need to be presented
Right.
with good alternatives.
And is it something, are we taking in those cultural factors in, right? If you're going to tell someone who, I know, my partner is Hispanic, right? And so as you see, if someone were to say, never eat tortillas again because those are bad for you, like that would be ridiculous, right? Because most of the food that I eat with my partner is, based on tortillas or, it's like, are there other ways that we can be healthy in those environments that are realistic and culturally based? And I think that is something that I don't see often. It's funny that you talk about translation too, right? Like, there's a lot of Spanish movies that are coming on Netflix right now that are being translated into English.
Mm-hmm.
And just we'll watch them together and we will laugh because the translations just make it sound stupid. It makes it sound silly when you actually look at it. So my partner will look at me and go, that is not what that phrase was meant to be translated as, like, very clearly to that day. And so when you don't have translation that is effective or meaningful in the dialects that those people are understanding, that is a barrier that does impact how people receive care, how people understand situations, particularly in a medical field where, gosh, how many crazy words do we use in the medical field that don't make any sense to anybody as is, let alone try to translate it, right? And so, there's just so many barriers that exist to that. And so, and part of that is also discrimination. Part of that is stress. Part of that is community engagement. There's so many factors that lead into that. And, we talk a lot about, in the education system is that your zip code shouldn't determine your future. And that can be in education, but that's not everything, right? Your zip code and your geography. In the city of Detroit, we know that people who grew up in Southwest Detroit have asthma because of the marathon factories and other things like that. And so, but then we don't do anything about it. We just say, oh, but how are all these, and I think that's what I try to see when I look at social issues and social justice. I look at, okay, well, how is your, I don't look at this as just social terms of health. Health is the base of it, but it's also just the base of every other social issue. So when you look at how do we address domestic violence, how do we address sexual assault, how do we address all of these different areas, more than likely it is based in something that is part of this framework. And so how do we then think broader and more systemic about, if we're looking to address hunger issues or, food insecurity, well, what other things are leading to food insecurity?
Exactly. And I'm glad you actually mentioned like the systemic, part of it, because that leads right into my next question, which is, I know you, and you are a firm believer in, policies on the state, local, and federal level that dramatically impact the daily lives of individuals, like changing fundamentally. And so what kind of dramatic policy change, what will that look like to you as we dive into creating a new normal, particularly like with regard to overcoming these systemic barriers?
Yeah, and so I think there's many things that are coming to fruition right now, right? You see health as a major factor, right? Just how is the inequities in health impacting people right now? I think that's major, particularly as, as we're looking at this COVID-19 crisis, and how does insurance work? How does free cost of care work? Not that that hasn't been included in many other things for many years, but finally, people can't get insulin to save their lives. They have to get it through a black market system, if they can't afford it. So you're seeing many things like that. I think you're seeing a lot of economic issues that are coming to fruition, a lot of things on housing policy. I think when you look at economic issues, it's like, okay, well, the things that we've talked about in this primary race on the Democratic side have come to fruition extensively now. It's funny now looking in the city of Detroit too and seeing, all of a sudden now water shutoffs are being stopped, right? Great. So now water is valuable because we're in a crisis.
And it's like, it's a human right. People should have access to water, to clean
and
water.
same when,
wealthy, industrialized nation.
Exactly. And same when you look at access to broadband or internet. It's like, how much how many things are telling, I get harassed by DTE and consumers every day to move to an e-bill, which I do. But like, for the people who don't or can't, how do we do that?
There's
How
a
do we make
there's a divide, exactly. So you're not going to have access to an app that now we're switching over to because you can't come to City Hall and pay the bill anymore. So,
right. And
that's
then looking at jobs too, and looking at unemployment, it's like, well, most of the people who are working in who are low income and whatever are working jobs that are considered essential. And so how are they supposed to address this crisis when they have to go to work?
And I'm actually not to cut you off, but I'm glad you mentioned that particular instance because that was something that the Surgeon General was sort of bothering me. I mean, not only because I feel like he looks like he's 12 years old and he's too young to be a Surgeon General, but he kind of was just like, all right, folks, as a Black person, I'm telling you, act right, do the right thing. It's like, no, when you think about disproportionately, you have a lot of, African Americans who are working in industries where, you're going to be the mailman, you're going to be working at a fast food restaurant, you're going to be working at, as an essential worker, you're going to be,
Right.
you're going to be out there exposing yourselves. And you also have an issue of like multi-generational households where, of course you're going to expose grandma to it because you live
Right.
grandma lives with her niece and nephew and her grandson and granddaughter. So it's like that is,
And, just to kind of jump off of that too, is that, you talk about sick leave too. Well, people have this, now we're luckily starting to address some of that with some of the COVID-19 pieces that have come up, but that's been an issue forever. You can't stay home if you're sick because you don't have access to sick leave. And other things like that is people who are working in these jobs. For restaurant industry particularly, they get nothing. They get terrible benefits and $2 an hour to start. So if people aren't tipping, how are we dealing with that, right? And so kind of all those pieces. I think there's a really telling phrase that I've heard over the years that I find very valuable, and that says, when white America gets a cold, Black America gets pneumonia, or
right,
or
right.
something that is so much more. And I think that just, to me, it tells me, or people of color in general, all of that's because there are so many issues that we need to address in that. And it's not just a white issue too, but looking at or it's not just a people of color issue, but it's for all people, right? It's for those.
It's an economic issue because if you're like poor, you are going to be, so it's not really about the color. It's more about, okay, you're not necessarily going to be getting the things that you need.
Thinking about rural areas, I mean, there are plenty of people there who, if they, looking at the hospital systems in rural areas, all of that, the reason why we're doing what we need to make sure that it doesn't get to those areas is also because their hospital systems have like one ICU doctor.
There's a stigma attached to being a country doctor, going way back into like the 1850s. Oh, he's the country doctor. And so it's like you're going to be a little behind the rest of the more, urban medical scene. And so also you're probably not going to know as much because you're not really being exposed to the big issues that, bigger hospitals are equipped for. So that's a problem in itself.
Right. And so it's and that's why it leads back to the systems, right? We know that there have been racist systemic policies, of course, and that is a major factor, but for everybody, we're all being screwed over and getting mad at the people who are in the same boat as us, right? Rather than getting mad at the people who are at the top making these decisions and making and taking the money while we all suffer, right? And so how do we start to address that? I think when you hear, and this is actually a really interesting time to talk about, and thinking about the policies that Elizabeth Warren and other people like that who have been, trying to say we need to make sure that we're investing in worker-friendly policies and not policies that are, related to just addressing the business needs or addressing things of that sort. This is the time now that we need to start saying, let's address the needs of our workers, because it's not the person at the top who's making the money. The person who's making the money for you are the people at the bottom. The people who are making money, it's funny to me that even now, we're talking about hospitals taking huge cuts of employees and layoffs, yet their CEO last year made, multi millions of dollars, I think up into double-digit millions, right? So like 10 million, 20, 15 million. And same with, health systems and health insurers. Okay, well, the CEO of Blue Cross is still making $23 million a year in compensation. But yet now we're talking about laying off all those people and doing a bunch of these other things that are ridiculous. Or, Blue Cross and others are known for just not paying. health providers or paying the bills of all these people. They, to make you go through hell in a handbasket just to get, a simple procedure covered, because God forbid it's going to take, cost so much money, right? And so all these things lay up when, again, we need to address policies that are worker friendly rather than helping those at the top every single second. See that with a lot of the legislation that's come out, as small businesses, for example, are struggling right now. And much of the money that's been coming out, think about your local mom and pop shop. Do they have a strong relationship with their bank? Probably not. Do they have a strong relationship in the networking to be able to get past some of this crazy legislation? Probably not. And so how do we address that? How do we move that forward? So that we're actually addressing the needs of our small businesses. When you think about something that I find funny is that our small business associations see people, they mostly deal with businesses that are 10 and up. Well, what about the sole proprietorship? Have 10 employees or up. What about the sole proprietorship? What about the businesses that are under 10 people? They're the ones who need
it's serving small businesses. It's serving businesses that are, chains and franchises, but yet they have a fewer employees. But overall, they have, lots of employees, and they have a structure. They have a strong relationship with the banks, with, networking institutions and things. So
exactly.
That, they're kind of a little bit in a better place, so that, if something happens, then, you would think
Right.
they would just be in a better place to be able to bounce back.
And thinking about insurance too, it's like, this now it's come to a head about how employer sponsored insurance is probably not a way to go. We don't have any backbone when when people lose, when we now have, cajillions of people, 40% of our society basically now losing their jobs. And so now we have a bunch of people on unemployment, a bunch of people without insurance. How do we address those issues, right? This is all coming to a head. And so now we need to start thinking about, this is the best time that we need to start thinking about those policy solutions that are going to work for the benefit of all people rather than those at the top and those who, are millionaires and billionaires and all of that type of stuff.
Exactly. And I'm glad you touched on, that's the biggest part of how we can change healthcare policy, because, it's funny, in Theodore Allen's book, The Invention of the White Race, it kind of talked about the history of, people who were poor were always in the same boat with each other. So when you think all the way back to in America, slavery in America, you had, poor indentured servants, and you had, slaves who, they were all in the same boat of okay, we're poor, we don't have a lot of resources. If we band together, and a lot of the rebellions that were happening in the early 1700s were, mixed race, and people were seeing that okay, well, we have more interest together because we are not the powers that be. We are not the landed elites. We are not the gentry. And so therefore we need to demand more. And so, talking about demanding more, there is a history of doing that, coming together for, your economic reasons, your economic, interests are the same. So therefore you come together. But I think in recent times, we've seen this bootstrapping kind of divisive conversation come in, and where, people whose interests would lie with the same socioeconomic group kind of villainize people who are in the same boat as them financially, because of the fact that in some ways there's this divisiveness that says, oh, well, one day I'll be like the rich, one day I'll aspire to have that. And so why knock them when, they're out here being job creators, or, and it's just you don't demand that accountability that, say, in Europe, they would just say, okay, well, this isn't right, that we should all be being given this universal basic right. And so there was an episode of Samantha Bee's Full Frontal, where she kind of talked about how, if a room is on fire, and it kind of alluded to that meme that's out there where, if the room is on fire and you're just going to let yourself burn because you don't want somebody who is, a minority, or a person who is, dealing with financial hardships and things, you don't want to see them, kind of get an unfair advantage, when it's not an unfair advantage. It's an egalitarian advantage across the board for everybody to have. And I think we've kind of lost sight of that in some ways, thinking that people who are down on their luck, or people who are, on a lower rung of the socioeconomic totem, they're there because they made bad life decisions.
Yeah, and I think you see a lot of people who talk about that bootstraps thinking, and I think that's, sorry, my dogs are barking.
I'm putting mine on silent because I just know she's gonna come. This dog is gonna come barking, and she's gonna do something really like just make a crazy noise.
I love it. I know my dog started scratching at the door. I was like, "Can you stop? I'm on the call." No,
That's
but
the only time she does it though. Like any other time.
only I've never had it. I think a lot of this is, a lot of when I think about things is, I don't. It doesn't really matter about socialism, communism, all those things that people like to spray out. I think about collectivism. I think when you think about how do we impact each other,
Yes.
when we think about community, and I think that's something that I keep thinking about now in an age where we kind of don't connect in many ways that we used to, right? Is how do we think, not at all things that we do, we are all interconnected, right? It's the same with these systems that are connected. It's the same with us as people. We are all connected to each other, and we need to bring each other up. It is about community, it's about collectivism, and I think too many times we're thinking in an individualistic way. And the reality when you talk about bootstraps thinking is there are like 0.00001% who are gonna make it as a millionaire or billionaire. So the actual reality is that there are so many systemic barriers that exist that are just going to keep knocking you down and knocking you down when you try to pull yourself up. So I remember being in a car with one of my friends once and seeing someone on the side of the road, and he said, "Well, that's ridiculous. We have so many jobs at my work. He could come and be a dishwasher." I said, "Okay, well, what if he doesn't have strong transportation to get to that job? What if he doesn't have, if he came into your work right now and hadn't showered, likely in a couple of days. Unfortunately, that's, the reality for many of our individuals living with homelessness. Um, would you give him a job? No, you would judge him immediately and say, oh God, no, are we going to give him a job? Because that's the reality that these people are facing, let alone, the mental health crisis that has exacerbated that and the housing policies that have exacerbated that. And so, we like to say that people should just bring them up by their bootstraps. But there's also this reality of generational and situational poverty that we have to think about.
Thank you.
So
Exactly.
for me, if as someone who has had privilege in his life, who knows kind of the systems, but like the back of my hand, if something were to happen to me, if I were to lose my job 1 minute and get into poverty, I could get myself out of that pretty easily. But for someone who's been living in generational poverty for many years, for over family members to family members, you think about Maslow's hierarchy of needs, and many of them are living in safety, right? They're trying to just get to safety. They're taking care of their families, taking care of you're making sure that everybody in their family is safe, taking care of those basic needs. And so how do you can't think about that next level. You can't think about self-actualization. And so, if that I think is something that we just have to keep in mind when we keep thinking about all these things, is that it's collective. We have to think about each other. So thinking about your own life and your own issue is something that's not going to be effective, because your life is connected to everybody else's. And then same, again, thinking about too, I think the narrative piece of this, right, is that people think, based on, because of Reagan and, the welfare.
Economics and trickle down economics and things of that sort.
That's a whole nother piece on economics. But even just like the narrative of talking about welfare queens and stuff like that, and that whole narrative, it's like now people think that people of color are the people who are on welfare. Well, no, the majority is white people in rural areas, and so we have this automatic thing that has been put into people's brains that unless you start thinking about the data and thinking about what actually is that everything that either side is told is narrative, right? It's all about narrative. And so how do we break through that? How do we look at facts again? How do we continue to think that, not demonize our neighbors and our communities and our other people who are similar to us and going through the same situations? And then I think as we look towards the solution of getting out of this, as we get out of this, as we look towards what solutions we need to build, we need to bring all these coalitions together. We need to think about partnerships in a different way. So one thing that you think that when solutions start to be drafted is that you'll find people partnering that you might not think about, right? So if there's something going on with someone wanted like fracking or something in some sort of ocean, like you might have the conservation folks coming together with, the oil industry, for example, who might, there's just all these kind of different things that can come together. And right now, what we need is coalitions to come together and start fighting for what is right, because this is the time, because we're going to come out
It
of
has to be a unified message.
Absolutely. And we have to bring those coalitions together who are fighting for many of these different things, right? When I'm thinking of and looking at these lists of environmental hazards, in education policy, housing policy, all these different things, we need to bring together now, because we need to start thinking and moving forward the system and the society that we want to live in after this. And we need to fight for that at the moment, because
All right, all right.
that's the only way that we're going to come out of this in the way we cannot go back to what was normal. Normal was not good for so many people. And so we need what we are calling the, yes, new normal, but we need a new society. We need to build the society that we want to live in, because this is the time to do so. In times of catastrophe come times of change, right? We're seeing 5 to 10 years of innovations in a month right now. That are happening nonstop. And so how do we continue to move that forward, but think about it larger? I do think that it's necessary to have your grassroots folks push people and they move people forward, but you also need the people on the policy side who have those solutions drafted and ready to bring those movements together. There are only so many times when something is in the narrative and solutions can be drafted at the same time. And so this is the time to do so. And so we need to start thinking about that and have the grassroots folks pushing, and the people on the policy side moving that forward as well through the system.
All right, all right. I mean, like, I feel like I got like a little bit of a chill there, because it's just like, yes, this is the sermon that you need to like really motivate people. And so I just want to also tell my audience that Scott is also a New York Times bestseller. He is writing a book on how titled "Fix This, Scott." You got the answers. So yeah, I just kind of want to piggyback off of that, going into my next question, which is okay, by worldwide pandemic preparedness, America trails most of the industrialized developed world. We were late to roll out testing. A manufacturing problem with test kits that were initially sent out into the field were kind of delayed. We were delayed in also approving commercial test kits as a whole. And then as a nation, it kind of set us back in stopping or slowing the tide of COVID-19. Why is such a powerful nation performing so badly? Just looking at that from your, healthcare background and understanding that, and just even like, I don't know, I've been trying to figure out, like, just as somebody who's active in politics and in understanding that, people are saying like, why weren't we able to,
It's because we've left, this in times of crisis, this is when having a collective mindset is important, right? Because thinking about it on the national level, there were so many failures that we did not start addressing this crisis until March, early March, maybe late March. I mean, we started addressing it so.
I think it was more late March when you think about it. At least, on the state level, and then you saw, like the president made an address. I think it was like the second week of April or so, like maybe the 15th.
Right. And so as you think about that, right, it's like if you're ignoring the problem, you can't do those things in the beginning to start those steps that we need to protect the people, right? And so, when you started seeing Seattle having their pieces, having all their cases come up and the nursing school, I remember we were in the office talking about that even at that point at Bill, and and so we ignored that and just said, okay, well, they'll address it, whatever, it's fine. And then, thinking about the national strategy is that there isn't one. There isn't one where FEMA, so at the state level, so we've been struggling at my previous employer to even get, regular testing kits, regular PPE, and the national stockpile was depleted in less than a week when we should have been assessing this in the end of January. Even, I know the administration right now keeps saying, oh, the WHO didn't tell people this, yada, yada, yada.
That whole issue with like
late January,
like,
saying that this
stockpile wasn't for the states. Well then, okay, if you're the federal government, who are you, presiding over if not the states? And
right.
who is that stockpile meant for if not your country?
Right. And so you started seeing that they weren't addressing it. That as much as the administration is talking about how WHO didn't do their due diligence, didn't do their job, the World Health Organization, they came out and said that this will be a global pandemic at the end of January, and we still spent 2 months basically doing nothing about it. And so
And then the Trump administration did say like, oh, well, I was being impeached. So that's
and that you can chew gum and walk at the same time. CDC was not dealing with impeachment. All of those different pieces were not dealing with impeachment. You still could have put a committee together to talk about the different things that you need to do if a pandemic is coming through. And so, and then two, thinking about historical pieces, right? We had agreements in place that never went forward with building more ventilators automatically, things like that just were not there. And so then we left the states to fend for themselves. But then what happened? I know in the state of Michigan, we spent about something like $2 million to buy a bunch of PPE or testing. And then all of a sudden, the minute after we had already paid the invoice, after we already paid everything, FEMA came in and stole it from us. And so how can you say the states need to fend for themselves, but then the federal government's going to go through and buy everything up and then make pricing more expensive, make all these different things happen that make it impossible for states to actually address the issue on themselves. And then we think about state policy in these cases, right? States can't run a deficit, and yet the federal government doesn't want to spend any money on helping states and local municipalities get through this. Well, now look at what's going to happen next, right? Is that even on a local level, the city of Pontiac, where I live, just got out of emergency management a couple of years back, and we might be thrust right back into it because of the fact that state revenue sharing is going to be down. When we're going to have to assess what services are really necessary again, and we're probably going to go backwards on that.
exactly. And Michigan as a whole was dealing with it. I know that Harper Woods, we've been having some issues where we want to remain solvent, and so in some ways we never really want to get to cutting city services. But there's been a downturn, and we have been kind of dependent on revenue sharing. State revenue sharing is essential, and so you start to get to the point that Michigan, we had a hard time getting back on our feet after the 2008 financial crisis. And so now that we've kind of like been able to have some degree of prosperity, what is that going to look like for us coming back, full steam?
Right. And I think we're all going to struggle with that. Every state is going to struggle with that because all of their tax income is down. All these different pieces that lead to revenue are down. And so when you look at $3 billion that we need to cut over each year in Michigan, that is a huge issue. And this is why a national policy is there. I agree that states can do with their own things many times, and that's important to have some flexibility towards what you want to do. But in times like this, we need a national strategy. All states need to come together and address that. You're starting to see that in Michigan, right? We're a part of the coalition for the Midwestern states, things like that, and how to reopen the society. But this is the time that the federal government needs to say, these are the steps you need to take. This is how we're going to get out of this crisis. Here is your PPE. We will buy this, and we'll work with each of the different states on moving this forward. There are only 50 states and some territories, right? It's like, that is so much easier. I was just listening to something else too the other day, another podcast that talks about, how there's only so many peers that you can run to, and they all need to come together now, right? There's only 49 other people who you can talk to about what to do in this crisis, because no one else is running a state, at the time of a crisis. And so we are seeing a truly unprecedented crisis that has impacted every single piece. Even the financial crisis in 2008 and whatnot did not see restaurants close. Restaurants were fine.
And that was something I actually was having the same discussion with someone recently where, it was Phil Simpson who came on our Coffee and Conversations with small business entrepreneurs that we do at work at Build Institute. He was just saying that in 2008, he also, went through some tough times as a business owner, entrepreneur, and a creative. But things were still, you were able to take your family to the movies, you were able to go to the park, you were able to go out and not have this sense of impending doom all day, every day, where you're certain.
Exactly, right. I mean, I think that's what is so fundamentally different, is that everybody is being impacted right now. And that's hard, right? It's very hard to deal with that. It's hard to not leave your house, but the fact of the matter is that if the way that we're going to get out of this is by working together. We were already too late, and that's why we're in the situation that we're in. So now we need to do the steps and do what we need to do to get out of this in the right ways. I'm not saying I'm an epidemiologist. I'm not saying I'm an expert on anything, there are plenty of people who have plenty more experience in healthcare than me, but I think when you look at the general consensus, it's that we need to do this to get out of it because we are already too late and too many people have died. 80,000 people have died in America, and that is unacceptable. That is truly unacceptable, and that's because we were late with addressing anything, with all of these different solutions. And so when we're late with that, and we're not seeing that, and that is more than 9/11, that is more than many of our wars that have died because of this crisis. And so we need to act like that. This is impacting so many Americans, and I am not a firm believer that we need to let our elders die just because the economy is breaking. We need to figure out new ways to work the economy. We need to figure out ways to protect our people because that's what we are as America. This is we need to act collectively, and this is seeing that fracture.
I feel like in some ways, like, the government never really had a good track record of, just moving things quickly. There's always going to be bureaucratic red tape. And so you almost wonder, corporations are able to jump in and, just move things quickly. In some ways, since you have this rise in corporate social responsibility, what responsibility do they then have? I know that the Bill and Melinda Gates Foundation is really stepping up their efforts to, come up with a cure and eradicate this issue on a worldwide level. Like, what responsibility do smaller corporations kind of have in like, all right, we need to mobilize some of these issues, or even pharmaceutical companies, and how do we hold them accountable? Because in some ways they have the means and the capabilities to move things without a lot of regulation and red tape, but where is then the onus on them to, like, okay, well, this is going to affect us all. If you look at someone like Elon Musk being very upset that this is impacting him so negatively, but it's like, what have you actually done, Elon Musk, to kind of step in and say, okay, well, this is what we need to do, maybe we can ramp up testing, and I could somehow make an impact in a way that is philanthropic. When you look at other entrepreneurs and CEOs of big companies, they're like I said, Bill Gates stepping up. So
right. I think we have to. So I think there has been a good group of people who have stepped up, right? I think a lot of the foundations in this world have stepped up. You just saw probably a $200,000 small business relief fund that just came out from a bunch of the Pontiac Funders Collaborative and others that are connected for the Pontiac community. You've seen a lot of that come through. A lot of people finding money to give to hunger issues and other things like that. I think right now what you're seeing is a lot of people are giving to basic needs, and a lot of people are giving to small businesses. And I think that's great, right? That's the first step. I think this is the time when we need people to give more. This is the time when you need to show your value in society, because things are changing, right? We are finally holding businesses more accountable, right? But just doing a little bit in social corporate responsibility isn't always the way to go. You need to also be fighting too for the systems that are in place. Like I think we need to be holding businesses and corporations and others accountable to a lot of this as well. I think what's funny is that we talk about people, right? We think, going back to that bootstraps issue, is that you need to have 6 months in income, in your savings account at all times.
The average American is not ready for a $1,000 emergency.
Right. And apparently neither are businesses, right? Businesses, the minute that this happened, said, we need relief. And I'm not talking about small businesses because they're mostly working day to day, but I'm talking about your corporations. You said, oh gosh, life has changed so much. We need immediate relief or else there's going to be catastrophe.
Yeah, look at Neiman Marcus. I feel like everything in there is $1,000. Why did you not have the means?
Even the airlines and other things like that, it's like, well, maybe if you didn't spend the last couple of years after the tax relief that you got buying back all of your stocks and doing all of these
there we go
your executives,
yes.
And maybe you'd have some money, but you can't then come and say, it was funny. I was having a conversation with somebody the other day who is a fundraiser and other things like that as well, and she said, I have someone who started complaining to me, who has had a really strong business for many years, and said, she said, this year was supposed to be my best year yet, $20 million and stuff. And then started talking, and she's like, we really need that PPP loan. And my friend was like, do you really though?
Do you? Yeah.
You don't have enough money to be able to cover that in your savings account. God forbid you can't go to your second lake house, you know. And so it's also that piece too, is that many people, it's that individualistic thing. It's the same reason why we can't get a livable wage for people. You know, it's all of that together, because look at that. Someone's complaining because they weren't going to have a $20 million year.
But yet you think someone's being greedy and money grubbing if they want $15 an hour versus $8.50?
Right. Because it's going to move into your profit. I'm sorry, but I am a firm believer that profit should not go over people. And we need to address those issues that have been going on for many, many years.
Ever since, you know, there was a lot of, like in the 1930s, when, you know, you had like the stock market that crashed, and, you know, a lot of the protections and the regulations that were put in place then were saying like, okay, your corporate, you know, the stock, you can't really put so much of that back into your company, so that's the bottom line then becomes more important than being innovative as a country, as a company, more important than, you know, protecting your employees or doing well. And so I feel like in the 1980s and 90s, you saw this deregulation. And so now it's like, oh, well, our corporate CEOs now need to make, you know, 300 times what their employees make, you know, and I feel like that's when you started to move into like this almost, you know, tone deaf society where, you know, you don't realize that this is not okay, but yet you're
and thinking about how there's so much more lack of opportunity for other people, right? When we talk about small businesses, particularly people of color and women founders, you know, they have so much more lack of opportunity than people who are white males, right? They have venture capitalists don't give, they think it's a larger risk, you know, all those types of things. And so that's unfair, right? And so, you know, we talk about people who, you know, oh, how, you know, we need people who can innovate, and just because they got a good idea and got some money doesn't mean we should take it all away. Yeah, okay, right. But they should also be you know, thinking collectively about society. They should also be giving some of that money back. You know, gosh forbid another couple of percentage in tax that will fund most policies isn't going to kill you. Another, like, you know, if you're making $2 million a year and you're all of a sudden, you know, we have another, you know, a little bit more is taken out of taxes, isn't going to kill you. But for other people, that will change their whole life in policy, right? And so thinking about those types of pieces is so important as well, is that we need that. People who are rich are great, they are important, they're whatever, but we do need to think about how they can also give their fair share to society, and not thinking about, again, trickle-down economics has clearly failed for many, many years, and we need to start thinking broader about how that operates.
Thank you. This is why I love talking to you about like these issues. So, because it really does come down to, you know, just caring more and just being that person who, you know, you're not going to put greed over people. And, you know, this is definitely the conversation that needs to be had. You know,
And I
we're
think
both fellows in New Leaders Council, and we've been kind of talking about, you know, just social change and dismantling stigmas. And so you've talked a lot about being able to meaningfully address figuring out why an issue is the way it is. And so I want to know like how we've kind of addressed a lot of this, but, you know, better deal with societal perceptions of things like mental illness and mental health, and, you know, stemming the tides of homelessness and so on. You did kind of talk about that, and, you know, what kind of historically went wrong, like with why we kind of look at things so aggressively. And we haven't always been dysfunctional. We were talking about that, how like we were better angels before, but now it's like we're, you know, just kind of seeing. So how do we begin to figure out like why we think this is the best way forward? And is it going to really take something like this pandemic to put us in such financial and economic straits that we'll start to pull together, or do you think we'll become more fractionalized or fractured as a society?
I think we have started to see fractures, right? I think when people are dealing with a lot with their own crises and their own stress about what future will be, that only gets worse, right? And so how do we, yeah, I mean, you're right. How do we come out of this in a positive way? I think for the people, I think that's an issue, right? I think we're dealing with a really interesting time where data, facts, where narrative has taken on for more people than facts and data, right? So
And science. So people, it's almost like
in
people distrust
science,
scientists, they distrust academics, they distrust doctors, and any expert who or egghead,
right,
they're just like, well, the narrative, the story that I heard is more compelling to me than the facts that you present.
right. So it's like, how do you continue to address that in a time when it's funny because there's so much information out there and you can do so much research, but yet this is a time when I think disinformation and, those fractured pieces of society have become even more prevalent, because I think it's so much harder to suss out what is wrong, right? What is different. And it all is dependent on your perspective, your bubble, and your news sources and other things of that sort. There's a demonization of news sources for the most part. The news is, people like to say that
The fifth estate.
is our current administration. Obama was also demonized in the press. There's lots of things that the press does that might not be good, but there's also things that they need to move forward. And so it's how do we kind of move past that? How do we move past that in an information age? And I don't think we've yet figured that out. I don't think we've even come to the surface of figuring out that problem in society. And I think that is probably one of the biggest issues that I see, is that how do you combat all these narratives when there's 700 different messages all the time? People are exhausted. Right now, I know that people are exhausted. So yeah, I don't want to even be on Facebook and see all the different things that are going on. And so we really need to, I think that's one of the biggest issues that I see right now, is that you can't do anything unless we address all of these different things that are coming up in society about disinformation and all of that. But I do think it also is a time to come back and think about those underlying issues, right? I think when I talk about domestic and sexual violence, it's like, we know that housing insecurity leads to that, economic instability, substance misuse, some of the stigma on homelessness. We know that, when the state of Michigan decided to close all of their state-run institutions, that many of them ended up being sent out on the street. Many people just ended up being sent out on the street who had, moderate to severe mental illness. And so thinking back to why some of these issues are the way they are, and all of those, and that kind of background information is even more important now than it was in the past. And so now we need to start addressing those issues in that way, and thinking about how do we start to move that forward, right? Thinking about those stigmas, right? Why are those stigmas the way that they are? Why do people demonize mental illness? They've been doing that for years, right? People would drop their family member off at a mental
or something, and
institution and say, I never want to see them again.
Exactly.
How do you start to think about that and start to bring people in a different space? And a lot of that is about narrative. A lot of that is about bringing people into a different headspace, and learning from people. And I think what I've also heard is, let's normalize learning and growing, right? So right now, people just want to fight. That's it, right? Like, I have my answer. I know everything. Everybody is a pundit. We need to normalize. I don't say that I'm an expert on anything, right? I'm not an expert, because I could learn so much more, and there's so much more to every issue. But what I do recognize is that as I learn more information, I assess it out, and I bring it back to my fundamental beliefs. That's why I think politics to me is not something that is politics, right? Politics is not politics. It's not just this outlying being that's there. For people, politics is their daily life. It impacts every single facet of their daily life, whether that's local politics, state or federal politics, because all that impacts your daily life. And so to me, it's a values issue. It is my value that I believe that everybody in the society should be taken care of in a good way, and that nobody should be left behind. And so when I look at my values, that's why I go towards certain areas of the spectrum. But I think that's what is so important, is we need to get down to our fundamental values. If you say, as someone who is, this might be a little bit risque, but for someone who's, a church-going person, right, or says that they believe in Christ. Well, what does Christ talk about as fundamental values? Caring for others, talking about all that. But then when you look at church advocacy agencies,
They're all against anything that in their estimation, like, that's wrong. But it's like, if you were a true follower and disciple of the way that Jesus
Right,
led, it would have been with compassion and empathy, and
right,
serving your fellow man. And it wouldn't have been, I'm going to demonize you because you believe in abortion or you believe in gay marriage, or and it's just,
right,
where does that narrative come from when you call yourself a follower? And it just like a religion across the board, when in some way,
right.
the underlying philosophy is, let's care for our fellow humans, let's be better.
Right.
And
And if we were caring for other humans, we would also relate that back to some policy issues that they should be addressing, right? Those ones that we just talked about, right? When you talk about homelessness, well, okay, people would rather give money to one issue, right? Well, we wouldn't need nonprofits. My goal as a nonprofit is that I'm not needed anymore. My goal is to put myself out of business because I've addressed the issue. That is my goal as a nonprofit, not to be.
in some ways, when you think about it, like nonprofits in America, they're all around, let's feed people, let's make sure that people are educated, let's make sure that people have, access to clean water in Flint, or, and it's just, when you look at the rest of the industrialized world, this actually leads to my last question. Why is America, like, so getting it so wrong, when we're the same, kind of like wealth level, and there's this division? Because look at nonprofits in Europe, and they're all around like, let's come up with new and innovative ways to just improve technology. And our nonprofits are about, just coming up with something that's new and creative, and bringing people together. Let's be more sustainable as a planet. That's where they don't necessarily have to, feed the people, because the government is taking care of them. And so, in America, the biggest share of the population really lacks health insurance, and we carry more medical debt, which is another reason why we're not on the same wavelengths as like a lot of wealthy industrialized nations, particularly in Europe. We die more often from preventable causes, and Americans face higher out-of-pocket costs for medical care than citizens of almost every other country. So what have other countries done to achieve universal health care and to cover everybody that the United States has not?
I think it goes back to some of those fundamental philosophies. I am not someone who automatically says the government should be providing everything, or all your private industry should be. I think when you look at government intervention over the past many decades, we started with traditional public administration, and that led to a lot of interesting issues, right? Looking at things like favoritism and cronyism and all those types of things. And then we moved into a space, government was kind of providing everything. Then we moved into a space where we moved into new public administration, right, where we talked about cost-cutting measures and how we be efficient, and that was the only focus, right? Well, we have to, and then we started privatizing everything and contracting out and all these different things. So I think now we're moving to a new space where we need to recognize the role of government, right? The role of government is multifaceted. We have that triple bottom line as a government entity. It's as government as a whole has a triple bottom line to take care of citizens. If we were to say, nope, the reason why I think a lot of people don't trust government, and this is just one of many, but is because they've had such terrible policies and ramifications in many cases down the line. But at the end of the day, the last place that you're going to go is the government, right? Because they're there. Like, I talk about this with Honor Community Health a lot, is that, we're a good safety net entity and people forget about us until they need us, right? And then, and so when you think about government, like everybody hates them until all of a sudden they need them, right? Then, I said this with, a lot of the COVID-19 crisis, all people being like, well, if someone dies from it, they die from it. It's about survival of the fittest. And I said, until it impacts you, like until it impacts you, then all of a sudden you're going to be Karen at the grocery store yelling at everybody and their mother to make sure that your person doesn't die, or someone that you're connected with personally doesn't die. And so when you think about all those kind of pieces together, I think what we need is to start moving towards new public service, which is a philosophy that has kind of come out that talks about the importance of government looking at ways, things that are a little bit more strategic and innovative than they have in the past. So that's looking at, how do we do public-private partnerships in different ways? How do we partner with these different entities? Not everything that the government doesn't have to provide everything, right? But how do we do this in the best way is strategic and best for the end all be all values of taking care of society. So when you look at, right now we're dealing with something with the Phoenix Center in Pontiac. And so when I look at that, I'm like, well, wouldn't it be best if we had a public-private partnership so that the city's not all of a sudden getting into entertainment, the entertainment business? That's silly. Let's partner though with somebody. We need to start thinking about those broader community building coalitions that are government entities working with others, working with nonprofits, working with for-profit businesses, and how we can move that forward. Some of that might be the government is the best to provide this because that's the most equitable, right? But some of that might also be, yes, the public sector provides that the best. But we have to go back to those fundamental questions that we ask is, when is government intervention necessary? When is market intervention the best? When is, all those kind of different pieces that lead into policy decisions. And we have to start thinking about that in a broader context based on the values of society. And what is the role of that? The value of society is that we should be taking care of people. And that our people, and that we need to make sure that our citizens are taken care of. And that's all people. And
Exactly.
so I think when you look at, we talk a lot about equality. It's not about equality. It's not about equity, but it's not even equity. It's about breaking down barriers, so liberation, and then it's about inclusion. So actually including the people that we need to in society who have been left out. So we can't get to that. We are at such a small level of what we need to be at. We're just having the equality conversation. Well, even if you bring people up to equality, there's still inequities because you can't be equal if there are other systemic barriers and things that are in your way. But you also can't, why are we then investing $1 million resources when we could actually be addressing, you might have seen the pictures of the people standing on boxes to see over a fence, right?
Yeah.
Add more boxes for the last one, right? But why are we adding boxes? Why are we investing in that when we could be addressing the systemic barriers? And
lowering the fence. Why
exactly.
is that?
Or getting rid of the fence, blow up the fence. That's what we need. That's what we need to think about. And if we don't do that, then we're going to go back into the same type of situations that we've been in. And unfortunately, I think that always goes back to, inequities for the most vulnerable, inequities for people of color, inequities for women, all of that kind of pieces. So we need to start blowing all those barriers up and moving forward and doing it for the best of everybody. And so I think that for me, again, I think it goes back to that collectivism conversation is that we're all in this together. Even if that means that someone's getting a little bit more than you. As me, if I said, I would gladly pay more taxes so that someone else can so that we can make sure that someone else gets healthcare, that someone else, if I were making $1 million, my philosophy would be the same way. What am I spending $1 million on?
Thank you. And that was something that, James Chapman, one of our guests on Coffee and Conversations as well, he did a TED Talk where he talked about pick him up. He yelled, pick him up in the first 2 minutes of the TED Talk where he's just saying each one teach one, you can't just, leave somebody behind while you go and you have the glory. He was talking about, a sports game. I'm not sports, so I don't know if it was basketball or baseball, but he was just saying that you can't just leave somebody behind, and entrepreneurship and, just society should be let's do for each other. And, getting back to the question of Europe, when you think about, how wealthy industrialized nations as a whole, they tend to want to invest in things that the society as a whole is going to enjoy, because they don't say oh, well, this is just for us wealthy elites, or this is just for the middle class, or I don't want those kind of people using this particular, it's we'll make it for community benefit. We will, invest in libraries and museums and, healthcare for everybody, because of the fact that it's going to benefit me, you, my cousins, my friends, and it doesn't matter because it touches everybody, and everybody together is benefiting from something that's good. It's a public good. And that's kind of the unit function, it's unit function of just a society where you're providing something that's homogenous for everybody. And it's it's a part of something that, this is why even lately you've seen things in America where we don't want to fund that, the DIA. Why should we have to fund that? I don't go to the DIA that often, but it's
right. Well, and you see that with public transit a lot. Is just because I won't use it doesn't mean that other people don't need it, right?
Mm-hmm.
And I think that's one of the fundamental issues that I see is when we talk about, the rich and corporations and other things like that is that just because you're rich doesn't mean that you are more valuable to get to decide who gets what in society. And I think that is, a fight that I kind of have seen. Being in development is interesting, right? Especially when you have equity conversations, especially when you deal with funders. And I value them and appreciate them, but right, like most of those foundations are set up because someone who was rich put it into an endowment, right? And that is why they last forever. And so they get to make funding decisions about who is most valuable in society. And I have seen, one of the things that came out of this in the nonprofit world is that, Black founders of nonprofits or Black people running nonprofits have gotten significantly less money during this crisis than others. And I have seen that nonstop throughout all of my work in development, is that, the grassroots people who are doing stuff on the ground, we have a great organization that does stuff with individuals who have dealt with trauma. So children who have dealt with trauma, lost a parent, that type of thing. And she is working like 75 jobs just to make ends meet and then running her nonprofit. Well, I'm like, well, wouldn't it be wise? Think about the impact you would have, because of course it's too risky to invest in her because she doesn't have all the fundamentals like finances.
And it's just like that is the problem, where you feel like, oh well, she should just have made better decisions, and instead but
well,
the impact that she's having on the society, everyone who comes into contact with her, is made a better person. Their life is improved, and that's not something that people see that there's a value in, versus Mr. Tech Startup, I have this app that's going to help people see more cats, and the cats show up about everything that they do. And so that's something a venture capitalist would be like, yes, I'm going to invest in that business, here's $75 million.
Right. And so for me, I'm thinking, wouldn't it be more wise if you invested in helping her set up infrastructure and capacity building, in giving her a salary, so that, giving her the ability to have a salary and general operating costs so that she can pay herself, so that she can build a staffing structure, so that she can build all these different things. But you guys don't want to do that because it's too risky. So we see the same thing for venture capitalists and foundations, right? Like there's such inequities in that. We have all this equity conversation in the foundation world, but then what are we actually doing in equity? Because we're still putting up barriers, when I'd say that the people who are using grassroots nonprofits are some of the people who need the most money. But instead we're giving to the elite nonprofits. And, guaranteed, I love what some of them do, but like when you look at Susan G. Komen and others, it's like, oh, you're going to keep giving $1 million kajillion to all these foundations. And I have no problem with foundation, with nonprofit people being paid what they should be, similar is, but it's like, you're going to keep giving this money, but then what's the best impact? But then leaving all this money on the table for the people who are doing actual work. So, my friend Coleman runs an organization called Micah 6, and we, run on a nipple $200,000, and it focuses on food insecurity and neighborhood stabilization. But yet some of our other similar entities dealing with food in the area get $1 kajillion a year. And so, it's a lot of that same conversation about like the people who are rich get to decide who is valued in society.
Worthy. Like this is who we think, an example of who should be rewarded,
Yes.
for their hard work. And the
whereas
other
if we
hard enough.
If they just provided a tax structure, the people who do focus on equity is for the most part the government. Now, I'm not saying they're perfect, but for the most part, the government now can be held accountable. And if we really tried, if we really kept pushing and we called our elected officials and all of that stuff and paid attention and were civically engaged and engaged in all these other processes, the people who you can hold accountable are your elected first.
Period.
Can be held accountable, period. Then they can deal with equity. If we had so many people calling and saying, this is unequitable, this is an unfair policy, we believe in this, I doubt that we would be in such a strong, different environment. I think we would be in such a different environment now than we have been. But we don't do that, right? I mean, I think that's where I think like the government is still forced to think about all of their citizens. Most of the government stuff, like the social determinants of health, that's a government-led framework. And so the government has.
I didn't even know that. I didn't know that. I'm just thinking. I
mean, it's led from some other, but like.
It's just, terminology that maybe a couple of folks, and it's not something that everybody across the board would know. So.
It is something that is led by the federal government, it's something that's on all state government. Like they are thinking about equity in so many different areas, and they're thinking about these systems, but we can't, but I think part of that is funding and other things like that they can't actually address the issues because they're not provided the funding. But if we actually invested and said the government can be held accountable in so many different ways, and if we elected the right people, if we brought people, if we continue to battle and make sure that our administrations are led in
and empower people with the knowledge to know that their elected officials are not only there for them to access. I've had so many people tell me, it's like, oh, you're council person and it's all so holy. I'm like, I'm still Ernestine. I'm a normal person. I'm accessible. Right. I give my phone number out to everybody. And if I can't work for you and then take it up the chain to our state senators, our state reps, the senators and representatives on, the Michigan level, the national level. Right. So, if I can't be that person for you, you need to realize that that's what we're for, right. And you demand accountability from all of us.
Right. And that's why policy is interrelated with everything else, right? That's why policy is related to all of these different issues, because you can't affect long-term change. You can bring it to the national conversation with grassroots stuff, but then you need to bring it to a policy side. And I think that is what's going to move us to the next level. It is a constant fight, and I think that can be overwhelming and just wearing down on people. But I think eventually, they always say the arc of justice bends to, the arc of the world bends towards justice, yada yada yada. But
no, yada yada. I need to hear that quote, because I don't know if I've heard the arc of justice. Tell me more about this.
But I think that's what we need to continue to focus on, and that's why I am someone who believes in the government, because there really are ways that we can hold those people accountable to make sure that equity is there. And the only way that because a business is going to do what's best for themselves, right? The government is really meant, there is a triple bottom line in government to focus on their people, to focus on equity, to focus on fairness, and all of these, civic participation, all these different things. And so that is what I think is so important about the government being a role in this, and holding others accountable. You can hold corporations accountable if you ain't going to give them money, right? if you give them regulation, or you say here's an incentive to hold us. That's why government is so important, because most of what businesses do is focused on government incentive, right? Like, it's similar to the tax benefits that corporations and why they move to different areas, yada yada yada, all that kind
of. And it shouldn't be that. So we dealt with this with the captains of industry in like the late 1800s and early 1900s, where you had the Carnegies, the the Standard Oils, and you had the Rockefellers, who were pretty much, they were more powerful than the government, and therefore right. It's like they would put out candidates who would then be their puppets. And right. Now we're having the same issues where, big companies like Amazon and, are going to different cities. It's like, hey, dance for me, pay me.
And the people
why it's worth it for me to invest in you, when it should be right. The people saying the other way around.
And the grassroots, who is really fighting for the poor? Who's fighting for low income people? Who's fighting for minorities? It's like, you really have to think about who has the power. The power is related to who has money, right? And that is just, we need to start building up all these systems again, right, in different ways. Because, for example, right, if we started to look at publicly financed elections, that would change how people have to, for Seattle, I think it's Seattle that has currently public financing for those elections. And they actually invest money as a government entity and give like $500 for every citizen in their entire city.
Yeah, which political action committee can like donate how much, and so
right. And so when you look at that, it's like, okay, well, now people have to spend their time at the doors and convincing actual voters to give them that $500, right? Isn't that a lot different than hosting political fundraisers and doing all these
$1,000 a plate?
Right. That changes how people get into office, and we need to start thinking about those solutions as well, because it really all, again, see, every issue that we brought up tonight, hasn't it come back to the same things, right? It's
exactly. And that really, and so, just to wrap things up, that was actually not my final question, but I really think that we have to be able to just kind of like, and I feel like social determinants of health, that's really, really important for people to see that there are barriers to, so many things that, and you gave this analogy